Hello, Dr. Lowe again. We're going to talk about a common deformity of the foot, bunions, also known as hallux abductus or hallux abductal valgus. And it is a deformity that's very common, and it's a result of a hypermobility condition where there's too much motion in the great toe joint. We call the first metatarsal phalangeal joint. And what ends up happening is that the fulcrum of action of that joint becomes disturbed because of the foot collapsing and being unstable. And what happens as a result of that instability, the joint begins to drift over laterally or to the side, leaving the joint cartilage exposed to shoe gear pressure. And as that cartilage becomes exposed to pressure from footwear, bone begins to build up. Reactive bone forces build around that joint, and that joint starts to become altered, and its axis of motion becomes disturbed, and it interferes with walking and degrades the quality of propulsion of the foot as we walk, because the toe is no longer straight. It's being sent over to the side, or the axis of the joint is deviated. So the condition of a bunion is mechanical. Ultimately, the treatment should be the use of medical-grade custom foot orthotics. There are some conservative treatments. Bunion splints can work very well, but you got to catch the deformity early. And sometimes the deformity gets bad enough to where we need to do surgery in order to realign the joint and restore function. That's sort of the last resort, but let's always start with the mechanical conductivity of the joint through the use of the orthotic. If we can stabilize the foot, stop the foot from pronating, and remove the forces on the joint, it will slow the progression of the disease, and it will make the foot more stable. And as the progression of the deformity gets worse, it begins to alter other parts of the anatomy of the foot, the lesser metatarsals, the toes, and so we see conditions such as hammer toe deformities, metatarsal calluses, intermetatarsal neuroma, plantar fasciitis. All of these syndromes are secondary manifestations that develop in the foot secondary to the instability of the foot's bunion deformity. Very common problem, easily treated, and I'm always available for consultations if you need help. I'm here to help.